Hello, everyone, and welcome back to Let's Talk Sarcoidosis. I'm your host, Dorothea Howard, and alongside of me is my co-host, Richard Hanna. Hey, Rich, how are you today?
I'm doing great. How you doing, Dorothea?
I'm doing well, thank you. I'm telling you, by popular demand, we have back Monica Francis from Aesthetic Dermatology and Dermatological Surgery Center. And I'd like to welcome you again to the show.
Thank you. It's wonderful to be back.
Thank you so
Great to
much.
have
And
you.
we appreciate it because this actually, viewers, will be a special show today. And we have been getting inquiries about skin cancer. So today, we're going to dedicate this show about skin cancer and how we can save lives with that. So my question to you, Mrs. Francis, what are the most common types of skin cancer?
Well, there are many types of skin cancer. One type is actinic keratosis. That's actually a precancerous lesion. There's also basal cell. That is the most common type of skin cancer. Squamous cell carcinoma, and then malignant melanoma.
Okay. And how common is skin cancer?
It is actually very common. About 1 in 5 Americans will get a diagnosis of skin cancer in their lifetime. So that's any of the types, 1 in 5. And about every 8 minutes, someone is diagnosed with malignant melanoma.
Oh my goodness, geez. And so what does skin cancer look like?
Different skin cancers look like different things. So they appear and they present differently. So actinic keratosis can just look like a rough, dry spot on the forehead or on the face or on the arms. Kind of rough. Sometimes it may scab and you pick the scab off or the flaky, dry skin, but it seems to always return in the exact same place. And then that's the pre-malignant lesion. So what happens if that is allowed to go on, it turns into squamous cell.
Okay.
Now there's also basal cell carcinoma. That looks like sometimes it's a red lesion with a raised rolled borders. Sometimes it bleeds and then scabs and then bleeds and scabs. So a lesion that just doesn't seem to heal. Squamous cell is similar. Also, it can bleed or scab. Sometimes it can be very red, just a non-healing lesion. And then malignant melanoma, that is the most fatal. That's the worst kind. And that can come as many different colors. It can be black, it can be blue, different shades of brown. It actually is a bleeding lesion. So many times it is oozing or weeping, bleeding. It many times has the black and the blue and the brown all in the same lesion.
Wow.
So it's usually malignant melanoma arises from a mole that has been on the patient for years and it changes.
Wow.
So which types of skin cancer are fatal?
Malignant melanoma and squamous cell carcinoma. Malignant melanoma, people are more likely to die from if it is not caught early. But it can be caught early.
Okay.
But you just have to know the signs and what to look for.
Oh my goodness.
So who gets skin cancer most frequently?
Good question. So there are different patient population types and different kinds. So those who have red hair or blonde hair, those who have blue eyes, green eyes, or gray eyes, those who lived in a very sunny area, those who frequent tanning beds, those who tend to burn easily when they are out in the sun, those who maybe received a lot of sun exposure growing up. So that's very, very common. So it used to be that it seemed to be more Caucasians, but that's not always the case. It could be any of those, any patient population.
Where is skin cancer most commonly found?
Skin cancer can be found anywhere, from head to toe. I see skin cancer in the scalp and on the soles of the feet and everywhere in between. But we do see skin cancer most commonly on the face. So forehead, ears, nose, lip is common, and then also on the arms.
Wow. Now, I know all the viewers are probably running to the mirror right now, checking themselves, because this is definitely a show that can save their lives. So in that respect, how do you perform a skin cancer exam?
A
Well,
skin,
a
self-skin
self-exam.
cancer exam should be performed monthly. So you should think about it like for women, the monthly breast exam.
Okay.
It should be performed monthly. There are a few things that the person should kind of get together. Not a lot, but they should have a full-length mirror. They should have also a handheld mirror, 2 chairs or 2 stools. I think that's about it. Now, when they view themselves in a blow dryer, they view themselves from head to toe with that handheld mirror, in addition to the full-length mirror to view all parts of their body from head to toe. So sometimes they need some assistance, but if not, you use the handheld mirror. The best way to look at the scalp, to look at the lesions in the scalp, is actually not yourself usually, but your stylist. Your stylist is a wonderful person who can look at your scalp. They're used to looking at your scalp on a regular basis, and the scalp is best viewed when wet. So when the hair is wet, you can just see right through it, and you can easily visualize lesions on the scalp.
Wow, so they can detect that something's wrong.
Yes.
At least. Wow, that makes sense. And what are some of the changes seen on moles?
Yes. So there's a system that's in place for checking changes in moles for malignant melanoma, the most serious, the most fatal kind. So it's called the ABCDE system. So A is for asymmetry. So what you do is you look at a mole and you cut it in half, either horizontally or vertically, and you see if one half matches the other. So if it's asymmetrical, then that's a concern.
Okay.
The B is the border. If the border is well defined, if you can take a Sharpie and just mark all the way around the mole, then that's great. Then you can definitely see where the border begins and ends. Sometimes moles, the color actually bleeds into the skin. So you can't tell, does it end right here because here it's brown, or does it end over here where it kind of bled into the skin and it's a little bit light brown? It's hard to tell. So the border is important. See its color. It should be of uniform color, one color, usually brown, but we see red and we see blue sometimes, but usually brown, different shades of brown. If a mole is black or blue-black, then that's a reason for concern. If there's more than one color, if it's black, brown, and blue, then that's a problem as well. D is diameter. It should be about the size of a pencil eraser. So if it is larger, then that's a cause for concern. It doesn't equal skin cancer. It just means it's a cause for concern. And then E is elevation or evolving. So if it's always been flat and now it's raised, or it's just changing. It's just changing. So those are the ABCDEs of melanoma. Now remember, just one positive on those 5 parameters doesn't equal skin cancer, but it is a cause for you to see a specialist about it.
Right. And how is skin cancer diagnosed?
Skin cancer is diagnosed through a biopsy. So biopsies usually are done in a dermatologist's office, but they can be done in a primary care physician's office, internal medicine. But a biopsy is the test. And a biopsy is done with actually a numbing of the skin, so the skin is anesthetized, and a piece of the skin, tissue, is actually removed and sent to the lab in a jar of fixative. And so what people think, if they just pull a hair or scrape it, that's not a biopsy. We actually want all of those cells at the different layers, so the epidermis, the dermis, and the subcutaneous level.
So how is skin cancer treated?
The great thing about skin cancer is it can actually be cured.
Really?
Even better than treated. It can be cured. Even malignant melanoma can be cured if it's caught early. So with skin cancer, after a biopsy has been done and a diagnosis has been made of skin cancer, whether it's basal cell, squamous cell, or malignant melanoma, or some of the other rarer types, what they do is the lab will let us know if you got all of it in that portion or if there's still more left from when they look at the borders. So if the margins or the borders are clear, then they let us know you got it all, or there's still more to it. So if there's still more, then it can be completely excised. So we go back in and we cut it out.
Right.
Now there is a subset of dermatology actually called Mohs surgery, and that's M-O-H-S, Mohs surgery, and that is a specialty within dermatology, and all they do is cut out skin cancer. But the great thing about Mohs surgery is they have a special lab in the back. So once they take out the piece, they actually take that tissue to the back and they look at the cells and they know right there if they got it all or not.
Oh, that's great.
So if you're in a regular medical dermatology office, they take out the piece, they put it in a jar, send it to the lab, give you some stitches, send you on your way.
Right.
But if you're in a Mohs dermatology center, then they can actually go in the back, they make sure they have it all, and then they can sew you up. Now if they didn't get it all, then right there they can take more out, as opposed to having you come back
Right.
and have surgery again.
Oh my.
But a biopsy has to be made first before Mohs surgery can be done.
Okay.
Well, how can I prevent skin cancer?
Great question. Skin cancer, there are many ways that skin cancer can be prevented. Number one, we want sunscreen. Sunscreen, 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 sunscreen. Every day, and that's a different thing.
Yeah.
People don't think about sunscreen during the winter, but sunscreen should be applied all year round. All year round, summer, winter, sunscreen should be applied whether it's raining or cloudy. It's okay, the sun is still shining. If you've ever been on a plane, the plane flies above the clouds and the sun is right there. So first thing is sunscreen. What you also should do is, if you are out in the sun, maybe you are on a vacation, you want to avoid the sun from 10 to 4. That's when the sun is shining at its hottest time. So you want to avoid from 10 to 4. Also, you want to avoid tanning beds. Avoid the tanning salons. Also, we recommend that you just do your best to protect yourself. So wear a hat. If you are in the sun, you just get under a tree or shade. Those are the best ways to prevent. And also do the monthly self-skin examination.
Right. That's the most important part right there.
Yes.
Why should people use sunscreen?
Sunscreen does a number of things. First thing it does is it helps to, studies have shown that it helps to prevent skin cancer. So that's important. It helps to prevent skin cancer. Sunscreen also prevents sunburns. Anybody can get a sunburn. Doesn't matter your race or your background. Anyone can get burned. So wearing sunscreen prevents the burn. Also, sunscreen prevents the signs of aging. So the sun's damaging cells that shows wrinkling and darkening of the skin, where it's leading to skin cancer. The sunscreen prevents all of that.
Oh, that's great. Yeah, everyone listen to that, because that's a major tip right there.
Yes.
So what are some of the changes, well, new changes to the labels on the sunscreen?
Yes, there's been a lot of talk recently about the sunscreen and sunscreen labels. So there's some words that the FDA and different organizations have just put out. What they say is no longer can they use the word sunblock, because there truly is not a 100% sunblock.
Okay.
It still allows some sun rays. So they can no longer say sunblock. They can no longer say waterproof.
Wow.
They have to say water resistant.
Okay.
Because can it truly be waterproof? Not
because they will wash it off at some point.
Yes,
right.
at some point in time you have to wash it off.
Reapply it.
Yeah, to reapply it, right?
Right,
So,
okay.
they can't say waterproof. And then also, usually you will not find UVA or UVB. They have to be a little bit more broad spectrum.
Okay.
So those are some of the differences. And then also, if it does say water, if it can't say waterproof,
Right.
the new word is water resistant. So if water resistant, it has to tell you when you can reapply after you've been wet.
Right.
So if you've been in the water for 40 minutes and it says, okay, after 40 minutes you have to reapply, or after 80 minutes reapply.
So that's my next question, is because I've had problems with this, sometimes that chalky look with
Yes.
sunscreen. So what I want to know is, and I'm sure the viewers, what do you look for when you're choosing a sunscreen?
Good question. For choosing a sunscreen, first you look at what's required. They need to say broad spectrum. So instead of UVA, UVB, broad spectrum, you do want water resistant, and you want the at least SPF 30 or higher.
Okay.
SPF 30, that's a sun protection factor. SPF 30 or higher. The great thing about sunscreen is they have so many different formulations. You can get a spray, which is great for children in the summer, going swimming. You just spray and go, and it can give you a really nice, even coating. You can pick a lotion. And you can pick, they have a stick that you can rub on.
Right.
Also, they even have some makeup in, some sunscreen in makeup as well. And some sunscreen is actually tinted. So when you rub it in, it actually has a tint in it, so it's not white. It doesn't rub in.
Okay.
So that we have tinted sunscreen.
Wow.
Also, with sunscreen, if it's allowable, when you're in the store, you can pop open the top if there's no plastic covering it, and give it a sniff. Give it a sniff. See if you like the way it smells. You can't. Sometimes they have samples. If they have samples, try it out, because some of them are thick. Those are the physical sunscreens. They tend to be thicker. Think the zinc oxide from many years ago. Very, very thick. Doesn't rub in very well.
Right.
And those are hard. They're not what we call cosmetically elegant.
Okay.
So if you're able to test it out, you test out and you find out what works best for you.
Right.
And then for sunscreen, like I said, sunscreen should be used every day.
Right, and that's the thing that everybody should remember, to use it each and every day, no matter what the weather. So here's the other question. Everybody wants to know, how much sunscreen should we really be applying to our body?
Well, one of the things I did was I brought with me an amount. I actually brought some golf balls. So here's a golf ball, and what can be done is the golf ball is about the size that should be used to cover the entire body. So this is a pretty fair amount, a golf ball amount. But this should be this amount that should be used to cover the entire body. Now, if you're not covering your entire body, what you want to do is, if say you're not going to be out in the sun, say at the beach, then you want to cover your face, including your ears, your neck, and the backs of your hands.
Okay.
All that is important. But a golf ball, or the size of the amount in a shot glass.
I'm sure people can remember that, the shot glass test.
Yes.
So I think everybody wants to really know, is sunscreen safe?
Yes, there's even been more talk about sunscreen. Some people are afraid of sunscreen. It is safe. There have been no documented studies to show that sunscreen is harmful to humans or is hazardous to the health of humans. So sunscreen is safe. Actually, studies have shown that sunscreens prevent cancer, and it is very safe.
Okay.
And really, what is so dangerous about indoor tanning?
Indoor tanning, actually by the FDA, the World Health Organization, they actually have said that indoor tanning is so dangerous that they have compared it with tobacco.
Really?
Yes, that's how dangerous they view it. A person who engages in indoor tanning on a regular basis, their risk for getting malignant melanoma increases by 59%.
Wow, that's a pretty high percentage, yes.
So we do consider indoor tanning dangerous. 1 or 2 times is not the enough to get skin cancer, but the studies have shown at least 8 to 10 times in a lifetime is enough to increase the risk.
Now, because I know I love the sun, and I'm always out in the sun every chance that I can get, and I do notice that sometimes I get these red blotches. I said, what the heck is this coming from the sun? So I don't know if I stayed out there too long, but you know, but I make sure I do use my sunscreen.
Yes.
Because I know that you always tell me to wear it. For those who don't know, that she's actually helps me. So one of the other questions, I know it, you know, we're almost run out of time, but is there anything that you want to tell the viewers that, you know, that we didn't cover here, that they may want to know?
Yes, there is one other thing that we do recommend that patients see a dermatologist once a year for a full body skin exam.
Oh,
That should be
okay.
done once a year. It's actually done more often if they've had a history of skin cancer.
Oh, okay. And then we know that once they see the credits, if they want to call for to get an appointment with you, especially
Yes.
in the local area, they can contact you to get an appointment so
Absolutely.
you can check them out.
Yes, we'll be happy to do that.
Okay, great. So before we end the show, I always like to turn it over to Rich, and he always have a great tip of the week, which is called the Coach's Corner. So Rich, what about the viewers' info today?
Well, I think first of all, thank our guests for coming out.
Oh,
I think She did a
absolutely.
great job. And in light of what she's talking about with getting checkups, it's important to also check on your financial situation. So many people, you have children and you have your financial portfolio. You should always do that at least once a year too. So if you
Yes.
haven't done it, please look at the credits and give us a call, and we'd be happy to help you. It's a confidential meeting.
Which is great. And we
Thank
still
you.
have a few more minutes, so if you wanted to, I'm sorry?
No, I was going to ask her a question.
Oh, yeah, I was going to say if you wanted to ask her a question before we go off the air, before I, end the show, you can definitely ask her.
In the African American community, a lot of
Yes.
people here, or they have melanin in their skin,
Yes.
and that they wouldn't need sunscreen. They can go out, that they're naturally protected. What are your thoughts on that and getting more African Americans to come get checked?
I agree with you. In the African American population, that's very, very true. Many times, if you ask them about their history, ask them about, have you ever been to an amusement park in the area? Been to an amusement park and been swimming? Have you noticed that you've gotten a sunburn? So if you have a sunburn, then there is a need for sunscreen. Also, if you want to, what I try to appeal to them is the cosmetic side. If you would like to go to your high school reunion and still look as young as possible, then sunscreen is the key, because sunscreen helps you to maintain your youthful looking skin and prevent the signs of aging. So sometimes it takes a little practice, but I definitely believe it can be done.
I do have another question, though. I know we talked about the sun tanning.
Yes.
If we just, not too long, but if we can just talk about a little bit more of the dangers, because we didn't touch a lot on that, and we know there's quite a bit of people that suntan, and there's a lot of controversy in the media about suntanning, but you as a professional, maybe you can also elaborate a little bit in regards to how dangerous it could be.
Yes, so you're referring to suntanning just in general?
In general.
In general. If we live, we're going to get some sun exposure, and over time we are going to tan. Now, if you burn before you tan, then you're more likely, you have a higher risk for getting skin cancer. There's nothing wrong with going to the beach and having fun on the water, but we recommend protection. We recommend that you avoid 10 a.m. to 4 p.m., and you wear sunscreen. And it's okay to have a tan. We just don't want patients to be burned. We want them to be protected. Long ago, people even used betadine and olive oil. Yes, they used betadine and olive oil and mixed it together and then laid out in the sun because they wanted the color. And we understand that. But we also want patients to be safe. And so sunscreen, when you use sunscreen, the rays still pass through, but the harmful ways are prevented. In addition to that, you can get a tan, but you don't get burned.
Okay. Well, I tell you, this wraps it up. I am so happy that you took time out of your busy schedule to come and help the viewers and get everybody the awareness that they need for sun protection. At this point, I would like to thank the viewers for watching the show. Thank you again, Ms. Monica Francis,
Thank you
Mrs.
so much.
Monica Francis,
Thank you so much for having me.
coming here and explaining this to everyone. And we hope that you got a serious message about this. As she mentioned before, the percentage of people who are diagnosed with skin cancer, this is a very serious situation, and this is why she's here today. And if you have any type of skin problems that you see after self-exam and you're in the local area, please look at the credits and contact Mrs. Francis. and make an appointment. You know, it's very important, and she says just like any other exam, once a year. So don't think and try to self-diagnose, because we all are guilty of going on the internet, Googling, and thinking that Google is the doctor. So please look at your body. If you see something is not right, contact Mrs. Francis and schedule your appointment just as like you would schedule any other exam. Even for people with sarcoidosis, you have to keep going back to the doctor. On that note, I always say, everybody who's the viewers out there with sarcoidosis, we all have sarcoidosis, but sarcoidosis doesn't have us. Until next time, take care of yourself, think positively, and make sure that you do self-exams. It's so important. We're trying to save lives, and hopefully we save one today. Have a great day, and thank you for watching.